proclamation of the El Paso County Board of Health recognizing National Nurses Week 2022. I'm particularly partial to nurses. I'm married to one. And let's begin. Whereas National Nurses Week is celebrated each year between May 6th, National Nurses Day, and May 12th, the birthday of celebrated nurse Florence Nightingale. And whereas the National Nurses Week honors the contributions and sacrifices of nurses and serves as a reminder to thank the medical professionals who keep individuals and communities healthy, and whereas nurses are extraordinary individuals who display courage, care, dedication, and commitment in caring for others, and whereas the American Public Health Association defines public health nursing as the practice of promoting and protecting the health of populations using knowledge from nursing, social, and public health sciences, and whereas public health nurses work to promote wellness and help prevent disease and reduce health risks at the population level through evidence-based care and education, and whereas public health nurses serve in many critical roles, and El Paso County public health nurses serve individuals and families across numerous programs and services, including nurse-family partnership, immunizations and travel, tuberculosis, disease prevention, reproductive health, and much more. Whereas the knowledge and skills of public health nurses enable them to make significant contributions to the public health through a unique combination of clinical nursing background with knowledge from the public health and social sciences. And whereas it is more important than ever to celebrate nurses across all fields for their unwavering care and dedication for their patients and communities. Now, therefore, be it resolved by the El Paso County Board of Health, the week of May 6th through May 12th is proclaimed National Nurses Week in El Paso County, Colorado. Any comments? Yes.
I have some after board members.
Okay, board member comments? Okay, Director Whelan.
Okay. I would like Cara Hamby, who is the program manager of Nurse Family Partnership, to come up with your team. Christy Durbin, program manager of Immunizations and Travel Clinic, with your team. Eric Gordon, who is our lead disease prevention nurse with tuberculosis prevention, and Summer South, program manager with our family planning clinic. And I would also like Deanne Ryberg, and maybe she stepped out.
Where's Deanne? Okay,
I will hold my comments for when she comes back in. Kara, if you can come up with your team and introduce your team with Nurse Family Partnership, who's here. Are they? Okay.
Hi, my name is Cara Hamby. I am the program manager for the Nurse Family Partnership program, and I have most of my nurses here today. I have Rowan Hall and Samara Pittman and Marie Chapman, Stephanie Dodson, and Sarah Elliott, and Elizabeth Anderson. On behalf of the Nurse Family Partnership team, we'd like to thank Dr. Turbish, the Board of Health, and El Paso County Public Health leadership for this opportunity to recognize the nurses and all the hard work that they have completed, not just over the pandemic, but in their entire careers. We have tirelessly worked to ensure that this community has continued to receive adequate and appropriate nursing services. Our team has worked innovatively and creatively to make sure that the moms and babies that we work with get telehealth services, which is not as amazing as when we can see them in person, but they have done it and done it really well. So thank you for this opportunity, and thank you for my team for all that they've done.
Great.
Thank you, Kara. And congratulations that we're recognizing you all, and we thank you for your hard work, and we'll bring you back up for a photo as well. How about Kirsty Durbin, who is the program manager with our Immunizations and Travel Clinic, and she also, served in putting together all of the logistics with emergency preparedness at all of the different vaccination clinics and ordering all of the vaccine supplies for our community and coordinating that as well. If you want to introduce yourself and also your team members.
Sure. My name is Christy Durbin, as Susan said, and I have part of my immunization team with me today. So I have Carrie, who is the Assistant Immunization Program Manager, and Laura, who is one of our newest immunization nurses. So I just want to thank Susan, Deanne, and Brenda for your incredible leadership over the last couple of years. To say that it's been challenging would be an incredible understatement, and I'm so grateful that we could look to you during that really challenging time. These nurses, it's just a portion of my nurses, they work to protect our community every single day, whether that's vaccinating kids and adults with their routine vaccines, giving them COVID vaccines to protect us, and also working out in the field at mobile vaccine pods. They're really the boots on the ground protecting our community. So thank you all for your support, and thank you for this recognition.
Thank you, Kirsty. And we'll call you back up a little bit later as well. But I did want to note, since we have Tom Strand, President of City Council, and also Dave Donaldson. We've put this out there, but Kirsty Durbin, our program manager with the Immunization Clinic, was recognized by Mayor Suthers for leadership, and she was part of a group, and that was within the last few months. So I think that is very significant that we've got such incredible team members here and expertise. And next, let's have Eric Gordon come up. And Eric, if you would like to introduce yourself, and doesn't look like you have anyone else from TB here.
Just myself.
Okay.
Thank you, Susan. So my name is Eric Gordon. I'm the lead disease prevention nurse, primarily working in tuberculosis and communicable disease. So I just want to take this opportunity to thank the board for taking the time to recognize National Nurses Week. So thank you all. I'd like to also recognize the many nurses that I have the privilege here to stand up with and also work with, both in the past and the present. I think we've seen over the last 2 years of this pandemic that nurses play a vital role in our community in obvious settings such as hospitals, clinics, and emergency rooms, but also here in public health agencies where nurses have been involved, as we've heard about, in all aspects of the pandemic response. And that can range from holding mobile clinics to provide vaccines, contact tracing in businesses, as well as identifying new cases of COVID in our community. All the while, there's also other nursing staff who are busy supporting and developing their staff who are often doing their, quote unquote, regular jobs while incorporating new responsibilities related to the pandemic. Even beyond that, I think nurses play an important role that might often not be visible to the public, often working behind the scenes. Such as the cases, the nurses that I work with right now, both inside and outside of this agency, who are involved in providing medical care, case management, and resettlement services to incoming refugees, in particular from Afghanistan, as we welcome these folks into our community. So again, thank you to all the nurses that I work with. I have a pleasure working with you, and also to the board for this recognition. It's appreciated. Thank you.
Thank you, Eric. And I have two more. Summer South with our Family Planning Clinic, if you can come up, and if you have any other team members here.
Hi, my name is Summer South. I am the Family Planning Program Manager here at El Paso County Public Health. I just started into this position last year, May, so I got to jump right into the hot seat. And I don't have any team members here with me today because they are upstairs serving clients, doing what they do best. I have 2 nurse practitioners that work with me in the clinic. I just want to thank all of you here today, Board of Health, County Commissioners, El Paso County leadership. This has been a phenomenal opportunity for me to continue to serve the community in the way that I've always wanted to as a nurse, to be recognized and honored for that. It's humbling and so very unnecessary, but very much appreciated. But jumping into the management role has been nothing compared to what our staff has dealt with over these last few years. I came into this during a time of transition from being partially telehealth services and part-time in clinic, and then fully pivoting into full-time services. They took it in stride. My team is phenomenal. The camaraderie, and especially I share a clinic with immunizations, and just working alongside all of these incredibly dedicated professionals has just been an honor. I am so excited to be here. I plan to be here for a very long time and to continue to serve the public. So thank you very much.
Thank you, Summer.
Appreciate it.
And last but not least, Laura Stern with our Maternal Child Health Program. If you could come up and introduce yourself.
Hi, thank you. My name is Laurie. I'm a nurse care coordinator, lead with our HCP team. I brought a few notes to say because I'm a good nurse, not so much public speaker. So thank you for recognizing the work and dedication of the nurses at El Paso County Public Health through this proclamation acknowledging National Nurses Week. The role we play in nursing is very different than what we probably had envisioned. However, I consider being a public health nurse a great honor and privilege. I place high value on the work that I do within our community and the direct influence that I have on the health and well-being of children and families. I am working with some of the most vulnerable in our community and provide education, tools, resources to improve health outcomes. I'm grateful to work for an agency that values citizens, promotes equity, prioritizes prevention, and appreciates health. Thank you again for this very special recognition.
Thank you, Laura. And I'd like our Deputy Director, Deanne Ryberg, to come up, please. So I think many of you might know or may not, but Deanne is a public health nurse. And I think that it's incredible. It's an incredible benefit to our agency to have a Deputy Director who is a public health nurse, understands science and clinical, and also has a master's in public health as well, which our agency is largely about population health, but we do some clinical as well, and it's a symbiotic relationship, as I was saying earlier when Kari was up here. And so I want to emphasize how much, our nurses, public health nurses, are heroes. I don't think that they get enough recognition. As Eric said, a lot of times, they are behind the scenes, and they are out there preventing illness and disease, addressing health equity issues, and they are improving overall community health. And so on behalf of the board and our entire team, you guys are highly valued. And I am so happy to actually see you because I've missed you. And as we're transitioning back into, many programs that were not clinical, that, we are telehealth and being innovative about how we approach our work, know that your leadership team appreciates tremendously the work that you do. And, sometimes we might not get the chance to say it, but these past couple of years and your adaptability and your flexibility and the leadership that you've shown does not go unrecognized. So we want to celebrate you, and we need to do it more often. So thank you so much. And if Deanne wanted to say something, those are my comments for this recognition week.
Thank you, Susan, and thank you, Board of Health members, for recognizing our public health nurses and the important role that they play in our agency. And I just have to say, I'm so glad that my career path took me to public health, because what a wonderful opportunity to mix a desire to serve, a desire to help people with science, and to have the opportunity to serve the community that we live in. And I'm so grateful for that. And also the unique opportunities that public health nursing affords all of us. I've had the opportunity to respond to Hurricane Katrina as a public health nurse. I've had the opportunity to be part of our response for the last 2 years. And those moments of serving a community in crisis, it's a privilege to be part of that. And I thank the board for the recognition this morning. I thank my nurse colleagues at the agency for all of their incredible work and always striving for clinical excellence and service to the community. Thank you.
Any other board member comments about, any comments from the public about nurses? I have one quick comment. The very first thing I learned as an intern, as a new physician, is be nice to them. Because they can be nice to you and make your life a lot better. So thank you all. Thank you very much. Photo op? Yes. Okay. I think we should stand up and give them. Yes. Are we going to Move these out of the way? Okay. There we go.
Let us know what, like.
That's not me.
I know, it just smells good over here.
All right, everyone, we'll go ahead and take a few photos.